Dietary recommendations for people with kidney problems differ greatly from those for people without any kidney problems. They are difficult to understand, complex, and often the evidence supporting them is not very high. Therefore, there is little consensus about what a patient or person with kidney problems should eat. Today we are going to see what you should eat and what you should not eat if you have kidney problems. Let's get to it. First of all, it should be said that the recommendations that are going to be given in this video are aimed at those people with somewhat deteriorated kidney function. That is, with a glomerular filtration rate less than 60, which would be equivalent to a stage 3A or higher. This is because people with kidney function that does not reach this level of deterioration would not necessarily have to change their eating habits. Regarding the general population, the recommendations for them would be the same healthy diet as for the population without pathology. Therefore, everything we say is directed towards glomerular filtrates less than 60 milliliters per minute. And what is that of the filtrate? Well, it's an index that we doctors use to know how much your kidney is functioning. Higher filtrations mean that your kidney is working better, it's working more, and lower filtrations mean that your kidney is already working less. First of all, is diet important in the course of kidney function? Is diet important in terms of having a better or worse prognosis in my kidney disease? There are still many skeptics that what we do with our diet can have a direct or indirect impact on our disease. Therefore, it is very important to emphasize that what we eat or do not eat has an impact, in this case, very directly on the cause of kidney disease. For example, a high consumption of sugary drinks, a high consumption of processed meats and ultra-processed products. They are related in many studies to a worse renal prognosis with a higher likelihood of kidney disease progression and faster kidney disease progression, and a shorter time until renal replacement therapy is established, that is, dialysis or kidney transplant. Therefore, what we eat does have an impact on how well you are going to be. How long are your kidneys going to last and how much time will pass before they have to replace the function of your kidneys? Starting from this, we are going to start talking about macronutrients and micronutrients in a renal patient's diet. We start with macronutrients. The most controversial topic within the renal diet is protein. Should we or should we not restrict protein? Well, to this day, there is no clear consensus on what is best for patients with kidney disease. It seems that there is a modest benefit, a small benefit from slightly restricting. 0.2, 0.3 grams per ideal kilogram of weight per day, the protein intake. While there are studies that say yes, others that say no, others that say that restricting proteins increases mortality, some that say yes, that they have a benefit. Therefore, it's unclear. It's also not clear whether restricting protein in that amount benefits the patient due to the protein restriction per se, or because by restricting protein, high levels of phosphorus and high levels of salt are also being restricted, which are generally in protein products that people tend to consume in large quantities, like processed meats. Processed meat, for example, has a lot of phosphorus, a lot of salt, and also protein. Therefore, when you're eating processed meat, you're not only eating protein, you're also eating a lot of phosphorus, a lot of salt, which we know are elements that worsen the prognosis of kidney function. Therefore, we don't know if restricting protein works because of the protein or because of other things that protein-rich foods carry. So at this point, common sense, if restricting protein had an amazing effect on kidney function, there would be no more doubt. There would be no debate, and it would be recommended to everyone. But to this day, it seems that the effect of restricting protein in kidney patients is very modest, and moreover, it can cause other problems. Another series of problems at a metabolic level, at the level of increased sarcopenia, and at the level of functional capacity. Therefore, caution against intense protein restriction if you have impaired kidney function. Of course, the sources of protein you should take are high biological value proteins, meat, fish, and eggs. and you have to minimize the consumption of protein coming from ultra-processed foods. Sausages, especially poor quality sausages, due to their high phosphorus and salt content. As for carbohydrates and fat, the truth is that there is no consensus on what is best. As you can see, the recommendations are vague and ambiguous, with no consensus among experts. The best thing you can do regarding carbohydrates and fats is to increase the consumption of polyunsaturated fatty acids and, of course, reduce the consumption of trans fats to a minimum. Avoid refined processed carbohydrates, avoid added sugars. That the consumption of carbohydrates comes from mainly from fruits, vegetables, and 100% whole grains, and that fat consumption comes from real food. As simple as that. By avoiding processed foods, avoiding ultra-processed foods, we are avoiding a large number of elements that harm kidney function in the long term. And there is indeed a very important element to consider if you have kidney problems, and that is calories. There are two opposite poles: the renal patient, who is usually also diabetic and is overweight. In that case, returning to the optimal weight is very important. Why? Because obesity, overweight, excess adiposity is a first-order progression factor that worsens kidney function. If you are overweight and lose weight, your kidney will greatly appreciate it and you will improve your kidney a lot. The other pole would be the person older, with a lot of pathologies, with a lot of medication, and who tends to have a rather low weight, who struggles to ingest enough calories, and who is at high risk of sarcopenia. That is, low muscle mass and low functional capacity. Even more so when we are restricting the protein in the diet. Therefore, if that is the case, it is very important that you take the necessary calories, which usually range around 30 to 35 kilocalories per day per kilogram of weight. Otherwise, you will enter a negative nitrogen balance, that is, you will progressively lose muscle, all of which will worsen your situation. You will have a higher risk of hospitalizations, you will have a higher risk of death from any cause, and you will have a higher risk of getting worse. In general, the issue of sarcopenia is very important in kidney patients. Why? The kidney disease per se, it is a factor that promotes muscle catabolism. Due to a lot of hormonal, molecular, mechanical, metabolic changes at the level of comorbidities at the immunological level, a series of factors that create a microenvironment that favors proteolysis catabolism and greatly hinders muscle anabolism. Therefore, if you have impaired kidney function, you also have a higher risk of losing muscle mass. Especially if you're consuming few calories and little protein. That is, if you're consuming little protein on your doctor's recommendation. Because you've decided to restrict the amount of protein you take in, you need to consume an adequate amount of calories. Otherwise, your nitrogen balance is more likely to be negative and you'll lose muscle. Muscle is life. Muscle is a treasure that you need to preserve no matter what, and losing muscle means a higher risk of things going wrong. And that needs to be very clear to you. We continue with micronutrients, emphasizing salt consumption. We know that very high consumption, above 10 grams per day, and very low consumption, above approximately 2 to 3 grams per day, are associated with a worse prognosis. Very low and very high consumption are associated with more cardiovascular events, higher risk of heart attack, stroke, or cardiovascular events at the level of peripheral artery disease. Therefore, neither high consumption nor such low consumption. Do you know which food provides the most salt to the Spanish? Well, it's bread. And in addition to bread, ultra-processed supermarket products. Those are the foods that provide the most salt to the Spanish. Therefore, if you want to decrease salt intake, decrease bread consumption, and decrease the consumption of ultra-processed foods. It's not the salt you add to the stew, it's the salt you eat without realizing it. The same goes for sugar. It's not the sugar you add to your coffee, it's the sugar you consume without realizing it. In a bunch of products that you believe are healthy, that you think are good for you, because the label says low in salt or low in fat, and they're not, they're actually unhealthy products. So read the label, If it has more than 5 ingredients, it's not food, and avoid ultra-processed products. I'll say it once and I'll say it 500 times. Potassium consumption isn't a major concern unless you have high levels or severely impaired kidney function. Spoken, I'm talking about filters less than 30. You should restrict it in case you need to restrict it, then you should take around 2,000-4,000 milligrams a day. There are tables, there are lists of foods high in potassium, which are the ones you should avoid if that's your case. In addition, something you can do, and that is within everyone's reach, is to soak the vegetables. Soak the vegetables for several hours, so that the potassium stays in the water and you can consume the food with a reduced potassium content. Something very important is phosphorus. Phosphorus is definitely something to consider, and it is something you should keep in mind. The phosphorus content of the diet is directly related to worse kidney prognosis, higher cardiovascular events, therefore you should restrict it. And what gives us phosphorus in the diet? Where is the phosphorus? Mainly in poor quality sausages, which you should minimize as much as possible, and of course in carbonated drinks, sodas. Okay, so important phosphorus, we remember. As for calcium, there is no clear consensus, but it seems that restricting the calcium content of the diet to less than 1500 milligrams may have some benefit. It's also important to keep your vitamin D levels in the appropriate range, that is, above 30. We don't want them excessively high, but low levels of vitamin D are also associated with worse outcomes for the kidney. And finally, the recommendations regarding fiber intake do not differ from those of the general population. But it seems it's curious that fiber consumption is more beneficial for kidney patients, for patients with kidney problems than for the general population. Therefore, try to include fiber from vegetables and fruits in your diet. Having said that, guys, I remember that a poor diet based on ultra-processed products, a Western diet rich in processed meats, processed products, added sugars, refined carbohydrates, it is related to an increase in proteinuria, which is a factor in the progression of kidney disease, in which we look to know if the kidney is doing well or poorly increased blood pressure. Higher risk that the life of your kidney ends sooner rather than later. Higher risk that they have to dialyze you or that they have to transplant your kidney, and higher risk that your nephrologist gets angry with you. Therefore, we pay a lot of attention to the diet. It's very important if you have kidney problems. I hope everything has been more or less clear. It's a bit complicated. There isn't too much consensus, but I hope I've helped you as much as possible. Without further ado, that's all for today's video. See you in the next video.